Cardiopulmonary resuscitation (CPR) is an emergency procedure that combines chest compressions often with artificial ventilation in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is recommended in those who are unresponsive with no breathing or abnormal breathing, for example, agonal respirations, hands-only CPR. To carry out a chest compression, place the heel of your hand on the breastbone at the center of the person's chest. Place your other hand on top of your first hand and interlock your fingers. Position yourself with your shoulders above your hands. Using your body weight, not just your arms, press straight down by 5 to 6 centimeters (2 to 2.5 inches) on the chest. Keeping your hands on the chest, release the compression and allow the chest to return to its original position. Repeat these compressions at a rate of 100 to 120 times a minute until an ambulance arrives or you become exhausted. When you call for an ambulance, telephone systems now exist that can give basic life-saving instructions, including advice about CPR. These are now common and are easily accessible with mobile phones. CPR with rescue breaths. If you have been trained in CPR, including rescue breaths, and feel confident using your skills, you should give chest compressions with rescue breaths. If you're not completely confident, attempt hands-only CPR instead. Adults. Place the heel of your hand on the center of the person's chest, then place the other hand on top and press down by 5 to 6 centimeters (2 to 2.5 inches) at a steady rate of 100 to 120 compressions a minute. After every 30 chest compressions, give 2 rescue breaths. Tilt the casualty's head gently and lift the chin up with 2 fingers. Pinch the person's nose. Seal your mouth over their mouth, and blow steadily and firmly into their mouth for about 1 second. Check that their chest rises. Give 2 rescue breaths. Continue with cycles of 30 chest compressions and 2 rescue breaths until they begin to recover or emergency help arrives. Children over 1 year old. Open the child's airway by placing one hand on their forehead and gently tilting their head back and lifting the chin. Remove any visible obstructions from the mouth and nose. Pinch their nose. Seal your mouth over their mouth, and blow steadily and firmly into their mouth, checking that their chest rises. Give 5 initial rescue breaths. Place the heel of one hand on the center of their chest and push down by 5 centimeters (about 2 inches), which is approximately 1/3 of the chest diameter. The quality, depth, of chest compressions is very important. Use 2 hands if you can't achieve a depth of 5 centimeters using one hand. After every 30 chest compressions at a rate of 100 to 120 a minute, give 2 breaths. Continue with cycles of 30 chest compressions and 2 rescue breaths until they begin to recover or emergency help arrives. Infants under 1 year old. Open the infant's airway by placing one hand on their forehead and gently tilting the head back and lifting the chin. Remove any visible obstructions from the mouth and nose. Place your mouth over the mouth and nose of the infant and blow steadily and firmly into their mouth, checking that their chest rises. Give 5 initial rescue breaths. Place 2 fingers in the middle of the chest and push down by 4 centimeters (about 1.5 inches), which is approximately 1/3 of the chest diameter. The quality, depth, of chest compressions is very important. Use the heel of one hand if you can't achieve a depth of 4 centimeters using the tips of 2 fingers. After 30 chest compressions at a rate of 100 to 120 a minute, give 2 rescue breaths. Continue with cycles of 30 chest compressions and 2 rescue breaths until they begin to recover or emergency help arrives. If a person is unconscious but is breathing and has no other life-threatening conditions, they should be placed in the recovery position. Putting someone in the recovery position will keep their airway clear and open. It also ensures that any vomit or fluid won't cause them to choke. Follow these steps. With the person lying on their back, kneel on the floor at their side. Extend the arm nearest you at a right angle to their body with their palm facing up. Take their other arm and fold it so the back of their hand rests on the cheek closest to you, and hold it in place. Use your free hand to bend the person's knee farthest from you to a right angle. Carefully roll the person onto their side by pulling on the bent knee. Their bent arm should be supporting the head, and their extended arm will stop you rolling them too far. Make sure their bent leg is at a right angle. Open their airway by gently tilting their head back and lifting their chin, and check that nothing is blocking their airway. Stay with the person and monitor their condition until help arrives. Spinal injury. If you think a person may have a spinal injury, do not attempt to move them until the emergency services reach you. If it's necessary to open their airway, place your hands on either side of their head and gently lift their jaw with your fingertips to open the airway. Take care not to move their neck. You should suspect a spinal injury if the person has been involved in an incident that's directly affected their spine, such as a fall from height or being struck directly in the back. Complains of severe pain in their neck or back. Won't move their neck. Feels weak, numb or paralyzed. Has lost control of their limbs, bladder or bowels.